Welcome to my YouTube channel, Nurse Blessing. Today's video is all about nursing questions and answer with Rationale, Part 1. Please don't forget to subscribe to my channel. Thank you. Grandchild of a client diagnosed with Parkinson's disease tells the nurse about proposed gift ideas for the grandparent's birthday in 2 weeks. The grandchild asks the nurse which idea is best, which option is the best gift for the nurse to recommend. A. Quilt and soft pillow. B. Warming tray for food. C. Hearing aid with batteries. D. Perfume and makeup. Answer: No one. B. Warming trays can keep food hot, safe and appealing during the slow eating process of the client diagnosed with Parkinson's disease. Eating is slow because of overall slowed body movement, tremors, difficulty chewing and swallowing, fatigue and need for rest periods. This choice directly addresses a physiologic need. Question 2. The triage nurse is prioritizing adult clients to be evaluated in the emergency department. Which client does the nurse assess first? A. Client with a persistent nosebleed. B. Client reporting vomiting for the past several hours. C. Client reporting arm pain after falling off a chair. D. Client with a temperature of 37.80 C. Answer 2. A compromised circulation takes precedence over the other client needs listed here. Question 3. Which action by the nurse indicates understanding of herpes zoster? A. The nurse administers oxygen. B. The nurse administers a prescribed antibiotic. C. The nurse covers the lesions with a sterile dressing. D. The nurse wears gloves when providing care. Answer 3. D. Herpes zoster is shingles. Clients with shingles should be placed in contact precautions. Wearing gloves during care will prevent transmission of the virus. Use universal precautions in caring for the client to prevent transmission of disease to self or other clients. Covering the lesions with a sterile gauze is not necessary. Antibiotics are not prescribed for herpes zoster. Oxygen is not necessary for shingles. Question 4. A client with a fractured tibia has a plaster of Paris cast applied to immobilize the fracture. Which action by the nurse indicates an understanding of a plaster of Paris cast? The nurse A. Dries the cast with a hair dryer. B. Allows 24 hours before bearing weight. C. Handles the cast with the fingertips. D. Pedals the cast. Answer 4. B. A plaster of Paris cast takes 24 hours to dry, and the client should not bear weight for 24 hours. After the process of applying the casting material is completed, the material will start to dry in about 10 to 15 minutes. The temperature of the skin might rise as the plaster is drying because of a chemical reaction that occurs. When plaster is used, it can take from 1 to 2 days for the cast to harden completely. Question 5. The nurse is monitoring a child with burns during treatment for a burn shock. Which assessment provides the most accurate guide to determine the adequacy of fluid resuscitation? A. Skin turgor. 2. Level of edema at burn site. 3. Adequacy of capillary filling. 4. Amount of fluid tolerated in 24 hours. Answer 5. C. Parameters such as vital signs, especially heart rate, urinary output volume, adequacy of capillary filling, and state of sensorium determine adequacy of fluid resuscitation. Other options may provide some information related to fluid volume, in a burn injury, and from the options provided, adequacy of capillary filling is most accurate. Question 6. The home care nurse is monitoring a pregnant client with gestational hypertension who is at risk for preeclampsia. At each home care visit, the nurse assesses the client for which classic signs of preeclampsia? Select all that apply. A. Proteinuria. B. Hypertension. C. Low-grade fever. D. Generalized edema. E. Increased pulse rate. Answer 6, A and B. The two classic signs of preeclampsia are hypertension and proteinuria. A low-grade fever, increased pulse rate, or increased respiratory rate is not associated with preeclampsia. Generalized edema may occur, but is no longer included as a classic sign of preeclampsia because it can occur in many conditions. Question 7. The nurse should plan to implement which intervention in the care of a client experiencing neutropenia as a result of chemotherapy? A. Restrict all visitors. B. Restrict fluid intake. C. Teach the client and family about the need for hand hygiene. D. Insert an indwelling urinary catheter to prevent skin breakdown. Answer 7, C. In the neutropenic client, meticulous hand hygiene education is implemented for the client, family, visitors, and staff. Not all visitors are restricted, but the client is protected from persons with known infections. Fluids should be encouraged. Invasive measures such as an indwelling urinary catheter should be avoided to prevent infections. Question 8. A client is admitted to the hospital with a temperature of 99.8 F, complaints of blood-tinged hemoptysis, fatigue, and night sweats. The client's symptoms are consistent with the diagnosis of A. Tuberculosis. B. Pneumonia. C. COVID-19. D. AIDS. Answer 8, B. A low-grade temperature, blood-tinged sputum, fatigue, and night sweats are symptoms consistent with tuberculosis. A chronic cough, hemoptysis, weight loss, low-grade fever, and night sweats are some of the most common physical findings in pulmonary tuberculosis. Question 9. The client is admitted following repair of a fractured tibia and cast application. Which nursing assessment should be reported to the doctor? A. Warm toes. B. Pain beneath the cast. C. Paresthesia of the toes. D. Pedal pulses weak and rapid. Answer 9, C. Paresthesia is not normal and might indicate compartment syndrome. Acute compartment syndrome occurs when there is increased pressure within a closed osteofascial compartment, resulting in impaired local circulation. Question 10. Among the following signs and symptoms, which would most likely be present in a client with mitral regurgitation? A. Altered level of consciousness. B. Chest pain. C. Exertional dyspnea. D. Convulsions. Answer 10, C. Mitral regurgitation is defined as an abnormal reversal of blood flow from the left ventricle, LV, to the left atrium, LA. Weight gain due to retention of fluids and worsening heart failure causes exertional dyspnea in clients with mitral regurgitation. Question 11. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client for manifestations of which disorder that the client is at risk for? A. Metabolic acidosis. B. Metabolic alkalosis C. Respiratory acidosis D. Respiratory alkalosis. Answer 11. B. Metabolic alkalosis is defined as a deficit or loss of hydrogen ions or acids or an excess of base, bicarbonate, that results from the accumulation of base or from a loss of acid without a comparable loss of base in the body fluids. Loss of gastric fluid via nasogastric suction or vomiting causes metabolic alkalosis as a result of the loss of hydrochloric acid. Question 12. A female client is receiving formoterol. An assessment specific to safe administration of the said drug is: A. Vital signs B. Weighing daily C. Urine output hourly D. Level of consciousness. Answer 12. C. The osmotic diuretic mannitol is contraindicated in the presence of inadequate renal function or heart failure because it increases the intravascular volume that must be filtered and excreted by the kidney. Urine output also requires monitoring. Failure for urine output to increase after administration of mannitol should prompt cessation of mannitol and evaluation for possible renal or genitourinary issues. Question 13. A healthcare provider has written a prescription to discontinue an intravenous line. The nurse should obtain which item from the unit supply area for applying pressure to the site after removing the intravenous catheter? A. Elastic wrap B. Povidone iodine swab C. Adhesive bandage D. Sterile 2A2 gauze. Answer 13. D. A dry sterile dressing such as a sterile 2A2 gauze is used to apply pressure to the discontinued site. This material is absorbent, sterile, and non-irritating. A povidone iodine swab would irritate the open puncture site and would not stop the blood flow. An adhesive bandage or elastic wrap may be used to cover the site once hemostasis has occurred. Question 14. The nurse is creating a plan of care for a child who is at risk for seizures. Which interventions apply if the child has a seizure? Select all that apply. A. Time the seizure. B. Restrain the child. C. Stay with the child. D. Place the child in a prone position. E. Move furniture away from the child. Answer 14. A. CE. During a seizure, the child is placed on his or her side in a lateral position. Positioning on the side prevents aspiration because saliva drains out the corner of the child's mouth. The child is not restrained because this could cause injury to the child. The nurse would loosen clothing around the child's neck and ensure a patent airway. Nothing is placed into the child's mouth during a seizure because this action may cause injury to the child's mouth, gums, or teeth. The nurse would stay with the child to reduce the risk of injury and allow for observation and timing of the seizure. Question 15. The nurse creates a plan of care for a child at risk for tonic-clonic seizures. In the plan of care, the nurse identifies seizure precautions and documents that which items need to be placed at the child's bedside. A. Emergency cart B. Tracheotomy set C. Padded tongue blade D. Suctioning equipment and oxygen. Answer 15. D. A type of generalized seizure is a tonic-clonic seizure. This type of seizure causes rigidity of all body muscles, followed by intense jerking movements. Because increased oral secretions and apnea can occur during and after the seizure, oxygen and suctioning equipment are placed at the bedside.